G.Johnson, registered nurse, case manager with the Kidney Resource Service Program, and today I will be presenting a PowerPoint slide presentation on cultural competencies for the Hispanic renal patient. Renal patients have unique needs. Many also have cultural needs. Just being a dialysis patient in general, there's just a lot involved in that, and also adding to those unique needs as a dialysis patient, there's also cultural concerns as well. And the Hispanic population is represented in our renal population. We just want to make sure that we are able to address not only their health concerns but their cultural needs to really be effective in the care that we provide to them. Also, some of our patients are not bilingual, and so it is important to be able to communicate essential information that could help our patients with their care. In addition, being able to effectively communicate with our patients with a language barrier could help them also communicate their needs back to us. One nursing intervention is the use of our Spanish interpreter by utilizing the language line. Our language line provider is an approved provider that has been tested for accuracy, so that way we know that by using that provider that we are accurately relaying information to our patients, and also that we're accurately receiving information from our patients to be able to address their questions and concerns. In doing so, we'll be able to effectively communicate needs such as recognizing the early signs and symptoms of an infection, which is very important for our dialysis patients, especially when it comes to their access care with catheters and also their peripheral access. And we want to make sure that our patients are fully aware of those concerns and how important those symptoms are to recognize. And also, our Hispanic patients will be empowered to report information and their concerns back to us. And we can assist them as well with communicating that back to their doctors or their dialysis facilities. Another nursing intervention that would help provide care to our renal Hispanic patients is the use of a dietitian. The renal diet within itself has multiple restrictions, and we want to make sure that we're able to address not only those renal restrictions, also be able to take into account the cultural concerns and needs of our Hispanic patients. For example, we want to be able to educate our patients that the corn tortilla has more phosphorus than the flour tortilla. That's just one of the examples for those of that population that do have that in their diet. And we just want to make sure that we're able to relay that information to them to make those alternatives to their diet. Our patients will appreciate that we've taken the time and the care to address the language barrier and to really help them have an equal opportunity to be empowered to take care of their health. Such interventions can assist in decreasing the health disparities and improving their health outcomes because it minimizes the misinformation from a language barrier. And thank you so much for listening to my presentation on cultural competencies for the Hispanic renal patients. I hope this information is just some helpful tips to help us really be effective in providing nursing care to our Hispanic patients. Thank you.